AI and XR-powered digital therapeutics innovations, a reference for digital health professionals. Final chapter, a vision for the future digital therapeutics innovations. Part 2. 3. AI and XR-powered digital therapeutics for autism and ADHD, revolutionizing diagnosis and treatment in a world where developmental disorders like autism spectrum disorder, ASD, and attention deficit/hyperactivity disorder, ADHD, touch the lives of millions. Both families and healthcare professionals have long wrestled with the challenges of diagnosis and treatment. The complexity of these conditions means that traditional approaches are often slow, resource-intensive, and can lack the precision needed to fully support those affected. But as technology advances, so too does the way we approach care. Enter the age of DTX, where AI and XR combine to create groundbreaking solutions, bringing new hope for personalized, effective interventions. Challenges in traditional diagnosis and treatment. The road to diagnosing and treating ASD and ADHD has historically been a frustrating one for many families. For ASD, the diagnostic process can take months, even years, as clinicians piece together extensive behavioral observations, interviews, and questionnaires. Each case is unique. No two individuals with autism present the same set of behaviors. Some children may struggle with speech, others with social interactions, and yet others may display repetitive behaviors or experience sensory sensitivities. The variability makes it difficult for healthcare providers to detect the condition early and accurately. To further complicate matters, girls often present symptoms differently than boys, leading to delayed or even missed diagnoses. ADHD presents its own set of challenges. The symptoms, such as difficulty concentrating, impulsivity, and hyperactivity, can overlap with other conditions like anxiety or learning disabilities. This makes diagnosis difficult, often relying on subjective reports from teachers or parents, which may not capture the full range of the child's experiences. These traditional methods often result in delayed treatment, robbing children of early intervention opportunities that could dramatically improve their quality of life. How digital therapeutics overcomes these challenges. DTX offer a way to break through the limitations of traditional approaches. Through advanced AI systems and XR technology, DTX enables continuous, personalized monitoring and intervention that helps healthcare professionals make more precise and timely diagnoses. AI-powered diagnostics, a game-changer. AI is revolutionizing the diagnostic process. It brings precision, speed, and real-time insights to a process that has long relied on piecemeal observations. Imagine a child named Liam, who has been struggling with focus and impulsivity. In a traditional setting, Liam's diagnosis might involve long waits for appointments, followed by extensive consultations with specialists. However, with AI-driven systems, Liam could wear a device that monitors his focus, movement, and even emotional responses throughout his day, at home, in school, and during playtime. The AI system would continuously analyze the data, detecting patterns and fluctuations that provide deeper insights into Liam's attention span and behavior. Unlike traditional methods, which rely on limited observations in a clinical setting, AI evaluates a child's behavior in real-world conditions over time. If the system detects significant attention dips during class time, it can flag this for Liam's healthcare provider, allowing for early and targeted intervention. AI doesn't just collect information, it actively learns and adapts to the individual's profile, creating a more nuanced, accurate diagnosis. For children with ASD, AI offers even more transformative possibilities. Subtle behaviors, like the way a child makes eye contact, responds to social cues, or reacts to sensory stimuli, are often difficult to detect during brief clinical evaluations. But AI-powered systems can monitor these micro-behaviors in real time. By using sensors and cameras, AI tracks social and emotional interactions that might go unnoticed by even the most trained clinician. This data is fed into machine learning algorithms that compare it against large datasets of other children, helping to pinpoint signs of autism earlier and more accurately. Personalized and adaptive care with DTX. The true power of DTX lies in its ability to deliver care that is not only personalized but adaptive. Traditional treatment plans often take a one-size-fits-all approach, offering a set number of therapy sessions or generalized interventions that may not fully address the individual's needs. DTX changes this paradigm by continuously adjusting treatment based on real-time feedback. Take Emma, for example, a 7-year-old diagnosed with ADHD. Before DTX, Emma's treatment consisted of periodic therapy sessions and medication, with her parents and teachers struggling to manage her fluctuating attention levels throughout the day. With DTX, Emma's attention and behavior are monitored in real time during school hours using wearable devices. If Emma's focus starts to wane, her teachers receive an alert suggesting strategies to help her refocus, such as offering a short break. Meanwhile, her parents receive daily reports, allowing them to adjust her home routine based on what triggers or supports her attention. For children with ASD, DTX provides virtual environments where they can practice social and communication skills. These immersive, AI-powered simulations allow children to engage in real-world scenarios, like greeting a friend at the playground or asking for help in a store. In these controlled settings, children can practice without the fear of rejection or embarrassment, while AI provides instant feedback, adjusting the difficulty based on their progress. XR-powered therapy, immersive, personalized treatment. XR technologies are transforming therapy by offering immersive environments where children with ASD or ADHD can build essential life skills. Consider a 9-year-old named Max, who has difficulty focusing in class due to ADHD. Traditional therapy might involve sitting in a clinical setting, practicing focus exercises. But with XR, Max steps into a virtual classroom, where he practices concentrating on a task while the system gradually introduces distractions, like birds chirping or classmates chatting. The virtual world is a safe space, allowing Max to build his focus step by step. And the system adapts in real time to his performance. If he's doing well, the challenges increase; if he's struggling, the system eases the difficulty. For children with autism, XR offers similar opportunities. Social interactions can be challenging, but in a virtual world, children can rehearse these situations. A child named Maya might practice initiating a conversation with a virtual peer or learn to interpret nonverbal cues like body language or facial expressions. With AI guiding the interactions, the avatars respond to Maya's progress, offering more complex scenarios as she improves. These immersive experiences give children a chance to learn and grow without the social pressures of the real world. Current status: where we are today, DTX is already making waves in the treatment of developmental disorders. DTX products are showing promise in treating ADHD through gamified interventions, where children engage in immersive gameplay designed to improve cognitive functions such as attention, focus, and emotional regulation. These products leverage AI to adjust the difficulty of tasks based on the child's performance, ensuring a therapeutic experience that is both challenging and rewarding. Similarly, XR platforms are being used in autism therapy to teach social and communication skills in gamified environments. For example, children can engage in role-playing exercises with virtual characters in a simulated grocery store, learning how to navigate social interactions. These systems provide immediate feedback, and the therapy adapts in real time to ensure that each child is challenged but not overwhelmed. Future outlook: looking ahead, AI and XR-powered DTX hold immense potential to revolutionize how developmental disorders are managed. Future advancements will likely focus on expanding XR applications and refining AI-driven diagnostics to support even earlier detection and intervention. Additionally, Ongoing research is expected to enhance the personalization of these digital therapies, ensuring each child receives precisely the type and level of support they need to thrive. 4. AI and XR-powered digital therapeutics for behavioral addictions including substance use disorders. Imagine Emma, a 32-year-old woman struggling with smoking addiction, feeling defeated after numerous failed attempts to quit. Each relapse only adds to her guilt, and the judgment she perceives in traditional support settings leaves her feeling isolated. Then she discovers an AI and XR-powered DTX app designed for people with behavioral addictions like hers. This isn't just another app, it's a lifeline tailored to Emma's unique needs. As Emma logs in, the app doesn't overwhelm her with generic advice. Instead, it asks her specific questions about her triggers, stress levels, and craving patterns, creating a profile based on her responses. The program immediately starts gathering real-time data from her wearable devices, tracking heart rate, sleep, and stress, to monitor how her body reacts throughout her quitting journey. Soon, Emma notices that in moments of high stress, her smartwatch vibrates, prompting her with calming exercises. One evening, as a craving builds, Emma receives a notification, "Let's take a mindful minute." The app guides her through a breathing exercise, easing her urge to reach for a cigarette. Emma's therapy isn't limited to the app's text-based interventions. The XR component offers her immersive scenarios, calming virtual environments that relax her when anxiety hits. She's transported to serene landscapes and practices techniques to handle her cravings. Through the DTX's virtual CBT exercises, Emma learns to manage her triggers, visualizing herself resisting the urge to smoke in a safe, simulated environment. This interactive experience builds her resilience, empowering her to confront her cravings in real life. In the privacy of her home, Emma is supported without stigma. She doesn't have to attend judgment-filled group meetings or schedule therapy appointments. The app offers her personalized resources, mindfulness routines, real-time craving support, motivational stories from other users, and even video check-ins with a counselor. Emma starts to feel less isolated, motivated by her small daily victories, and engages fully with her personalized quitting plan. Weeks pass, and Emma's smoking decreases significantly. Her app celebrates these milestones with messages like, "You've reduced your smoking by 80%. Keep going." She's not only quitting smoking but reclaiming control of her life. The DTX platform evolves with her, learning from her data, and adjusting her therapy plan accordingly. Her future, once clouded by addiction, is now filled with optimism and strength, thanks to the personalized support of AI and XR-powered DTX. This transformative approach doesn't just help Emma, it opens doors for countless others struggling with behavioral addictions including substance use disorders, offering accessible, stigma-free, and effective support. It's not just therapy, it's a new chapter of hope. AI-powered DTX has the potential to create a new standard of care for addiction, one that is compassionate, adaptive, and available anytime, anywhere. For individuals like Emma, it's not just a new tool, it's an empowering path forward in their journey toward freedom from addiction, paving the way for countless others to find hope and healing in a highly accessible, stigma-free, and profoundly personalized way. 5. AI and XR-powered digital therapeutics for cancer care, reshaping cancer care. Cancer care has long focused on treating the disease itself, through surgery, chemotherapy, or radiation, but the long-term side effects, both physical and emotional, often go unaddressed. Patients can experience anxiety, depression, and cancer-related fatigue, CRF, during and after treatment, leaving many feeling lost once their active care ends. This was the case for Anna, a breast cancer survivor. After her successful remission, Anna faced new challenges, overwhelming fatigue, constant anxiety, and the lingering fear of recurrence. The transition from the structured support of cancer treatment to the uncharted waters of survivorship felt like stepping into a void. Her once carefully monitored life, full of doctor visits, tests, and treatments, suddenly became quieter, leaving her feeling disconnected and unsupported. That's where DTX stepped in, offering personalized, real-time support. DTX empowered Anna by continuously tracking her symptoms and providing customized interventions based on her health data. Her DTX app didn't just monitor her symptoms but also integrated behavioral and psychological support. Through a blend of CBT, mindfulness exercises, and psychoeducation, the app reminded Anna to stay active, helped her manage her anxiety, and tracked her progress. For example, when the app detected that Anna was experiencing poor sleep and heightened stress levels, it alerted her care team before her symptoms worsened. Her healthcare providers could then adjust her care plan, providing proactive and personalized support that kept her connected to her treatment team even after her active cancer treatment ended. Beyond addressing psychological symptoms, the app encouraged Anna to maintain healthier habits, helping her stick to her medication and physical therapy routines. It also tackled CRF, a common and exhausting side effect of cancer treatments. By sending gentle reminders and offering tailored exercise routines, the app helped Anna manage her energy levels and gain a sense of control over her body again. As Anna's care continued, the DTX system evolved, using ML to analyze her behavior and predict when she might need extra support. When her anxiety spiked or fatigue set in, the app responded with interventions, such as mindfulness exercises, personalized to meet her exact needs. This ongoing care ensured that Anna felt supported, not just as a cancer survivor but as a whole person dealing with the emotional and physical fallout of her disease. Similarly, Emily, another breast cancer survivor, found herself in a different stage of her journey. After her treatments, she faced lingering exhaustion and anxiety, unsure how to move forward. Emily's oncologist prescribed a DTX app that extended beyond her health needs. The app didn't just track her symptoms, it engaged her entire support network, from her family to her healthcare team, fostering a holistic healing environment. Emily's system used real-time data from her devices, adjusting her care plan dynamically. It tracked her physical health through her smartwatch, her emotional state through in-app surveys, and her surroundings, including factors like weather, which affected her energy levels. Her care team, family, and friends received updates about her progress, allowing them to offer encouragement when needed. One remarkable feature was the app's ability to predict potential health risks. If Emily's activity levels dropped or her stress indicators rose, the system would flag these as potential issues, enabling early intervention. This proactive approach ensured that her care wasn't just reactive but preventive. Emily never felt alone in her recovery journey because the app allowed her family to participate, creating a support system that transcended traditional healthcare boundaries. Meanwhile, Elena, in the midst of chemotherapy, struggled with the immense pain and anxiety that came with each treatment. Her oncologist introduced her to a XR game-based system designed to help manage her pain and anxiety during chemotherapy sessions. Donning the VR headset transported Elena from the sterile hospital environment to a serene forest, where she could engage in calming activities designed to distract her from her physical pain. The system was tailored to her specific medical profile, gathering data to adjust her VR experience in real time. When Elena's heart rate spiked, a sign of anxiety or discomfort, the VR world responded, leading her through deeper meditation or engaging her in calming puzzles. The system was not merely a distraction, it was a therapeutic tool that eased both her physical pain and emotional stress, helping her face chemotherapy with newfound resilience. In yet another corner of cancer care, Michael, battling cancer cachexia, found strength through a digital therapeutic app tailored to his condition. Cachexia, a syndrome characterized by extreme muscle loss, had left Michael physically weakened, but the DTX app provided a lifeline. It guided him through personalized exercises aimed at building muscle and reducing inflammation, all while being monitored remotely by his healthcare team. The DTX app adjusted the intensity of Michael's exercises in real time, adapting to his fatigue levels and muscle capacity. It also tracked his emotional health, providing guided relaxation exercises that helped manage the mental strain of his illness. Over time, Michael's strength returned, and he found himself feeling more in control of his body and his journey through cancer treatment. Lastly, Emily, another patient undergoing immune checkpoint inhibitor (ICI) therapy and radiotherapy, was introduced to a digital therapeutic system designed to predict the onset of immune-related adverse events associated with her treatment. The system used advanced ML to analyze her symptoms and treatment data, providing her doctors with predictive insights that allowed them to adjust her care before complications arose. This proactive, AI-driven approach transformed Emily's cancer journey, giving her peace of mind that her treatment was being continuously monitored and optimized. Through these stories, we see how digital therapeutics are reshaping cancer care, offering patients like Anna, Emily, Elena, and Michael the personalized, real-time support they need to navigate the physical and emotional challenges of cancer. Whether through AI-driven symptom tracking, VR pain management, or holistic care systems that integrate family and caregivers, digital therapeutics provide a new way forward in the fight against cancer, empowering patients every step of the way.